The next thing we should be discussing, we'll be talking about the stages of HIV infections. So stages of HIV infections is more of like the disease comes in, is basically laying low, right? So over some time the disease is progressing to adverse levels. So that's what you look at when you are talking about the stages of any disease condition. So for HIV and AIDS infection, first of all, you should know that it has about 3 stages, and it's the 3 stages that we'll actually be discussing, right? So the first one, you have the acute stage, which is also known as a primary stage, okay, also fully known as the acute HIV infection stage. So that one is usually between 2 to 4 weeks after you have been exposed to the HIV. So the virus is still making copies of itself. So the virus is multiplying rapidly. So a large amount of HIV is usually present. That's the virus is present in blood. If you do a blood test, you can dictate it. So you have symptoms like the flu-like illness, like fever, rashes, sore throat, swollen lymph nodes, muscle aches. Okay. So the tests that are usually done for this time is the HIV antigen and antibody test, or nucleic acid test. Okay, so the transmission is very high. Okay, so somebody having acute HIV infection can also transmit it. Okay, then we have the chronic HIV infection. It's also known as the asymptomatic HIV or latency. This one, the HIV is active, but it's not reproducing fast. Are you getting it? So people may have no symptoms. So this stage can last for 10 years without treatment. Okay, but if the person is undergoing treatment, it can last for decades before progressing to the 3rd stage. Alright, so even without symptoms, the individual having this type of HIV can still be able to transmit that HIV to the next person. Alright, then the 3rd stage of HIV is the AIDS. Okay, so you have the acquired immunodeficiency syndrome. That one is the final and the most severe stage of HIV. The immune system is badly damaged, and the CD4 count, the CD4 T cells is low. Those are the cells that should defend your body. All right. So a lot of symptoms here: weight loss, chronic diarrhea, opportunistic infection. So the person's immune system is weak, so they can now be able to pick up any type of infections out there. So without treatment, survival rate is just between 1 to 3 years with this. Okay, so World Health Organization also have another classification. This classification here was based on the main stages. World Health Organization has a classification based on how it affects your CD4 count cells. Okay, so stage 1, your CD4 cells are still up to 500 per microliter. Stage 2 is about 350 to 499 cells per microliter. Stage 3 of HIV is about just 200 to 349 cells per microliter. While the stage 4 is the AIDS now, your CD4 count cells, your CD4 cells, the count is usually less than 200. Okay, so that's what we have for the different stages of HIV infection. So that's what we got.